waiting for anybody, Stacy?
No, we're good.
We're good to go? Okay, good afternoon. Thank you for being here this afternoon. We did try and access a sign language interpreter, but we weren't able to locate one today in the city, so that is why we don't have anybody here able to provide that service this afternoon. So this morning, I called a meeting with the city manager. We have spent a fair bit of time this morning, and the city manager along with his staff going back and forth and making a number of decisions around city-run facilities. And when I've concluded my remarks, the city manager will give you the detail on exactly what it is that we're announcing. Since we last spoke 72 hours ago, we've done and have been relatively busy, still on the file. Saturday morning, we had a couple of hour meeting with our municipal emergency control group. A number of items were discussed there Saturday morning. We had a number of stakeholders around the table for that particular meeting. The city manager and I have been in constant contact through the course of the weekend as events continue to unfold. I have been following media provincially, nationally, and following the decisions that other organizations and institutions are making that potentially have an impact on decisions that we might be making here. And in that vein, yesterday morning I reached out to Patty Haidu about 8 o'clock in the morning. She called back, we had a conversation, and I just simply asked her to keep me informed, and was there anything that she had that she could share with me that might prove helpful in terms of the deliberations that we're making here within City Hall. So, I am becoming increasingly, and have been becoming increasingly concerned about the decisions that other organizations and institutions are making that can be impactful on city-run facilities. So, for example, we have seen, as one example, we have seen that Lakehead University and Confederation College have both made decisions that they are going to close at least their programming. I'm not completely certain if the buildings are closed or not, you may know, but as an example, what does that mean when we have thousands of people no longer able to take their classes or access their facilities? What may that mean for city-run facilities? So that's a concern to me, and we saw on Friday or Saturday, I believe we heard that Confederation College had made that decision. Lakehead University had made it a short time before that. I've always been concerned greatly as well with any decision that we would be making as a city, corporately, or any decision that we weren't making as a city corporately that might potentially have a negative consequence on our hospital. We all know, I think, that all North American hospitals are concerned that if there is a surge in demand as a result of this virus, numbers and people needing assistance and help continuing to grow, that my concern was that I didn't want the city corporately to be seen as potentially, through our decisions or indecisions, had done something that might have potentially led to that surge. That's why we're hearing everybody talking about doing work and making decisions that will flatten the curve. And I think that everybody appreciates and understands what that means. Some of what we will be announcing today here talks and specifically has the potential to address flattening the curve. So I'm very concerned about our decisions or lack of decisions impacting on what our hospital is facing today and what they may have to face even greater in the future. Additionally, we're all concerned with how this may change in a quicker fashion as snowbirds are returning, as people who are on March break. I don't know how many people will still go, but there will be some who had left already, I would believe, and taken a March break. And as they return, how that may change the circumstance, what we are dealing with here currently, and what we may have to see in the near future. We are also, of course, continuing to see almost on an hourly basis, if not on a more frequent basis than that, announcements of closure after closure by both public entities and private entities. It's just almost hourly. The landscape continues to shift and continues to change on a very rapid basis. For example, we know the Ontario Legislature is closed, we know the House of Commons is closed, private entities around the city, private gyms are closing, and we know, of course, that all schools in the province of Ontario are closed. That was announced last week and will stay closed for almost a fully 3 weeks from today. So the landscape has shifted, and as such, I believe that we as a community need to shift our approach. The city manager will outline in detail for you the decisions that we have made today. To close, I just want to say to the community, this is pretty much the ultimate team game that we are involved in. We are all in this together. Decisions that we make individually and collectively, decisions that we don't make individually or collectively have the ability to impact all of us. And so that is part of what has guided us today. We know that the decisions that you're going to hear about today will cause some inconvenience in the community, without a doubt. But hopefully people will appreciate and understand that what we are doing here today is guided by an abundance of caution. Some might say an overabundance of caution. But as I said, we are all in this together. What we do or don't do impacts what other people will be doing. We're mindful of the vulnerable population. We are considering be part of potential solutions there. The last thing I think I would say before I pass it over to the city manager for the examples of what we're going to be announcing and what we're going to be doing is that we're also very concerned about the economy here in Thunder Bay, as we are in Ontario and right across the country. And we would only hope that people individually are able to still find some capacity to support our local businesses, to shop local as best they're able, till we get on the other side of this issue. So again, I thank you for being here this afternoon. I'll be here for some questions, but now I'm going to turn it over to the city manager to give you the details on exactly the steps that we will be taking. Thank you.
Thank you, Mayor Morrow. I'd just like to reiterate a couple of points made by the mayor. The mayor and I have been in constant discussions over these past few very busy days. I've also been in constant discussions with members of City Council. The Municipal Emergency Control Group met on Saturday morning, and there's been several discussions and constant communications with Dr. DeMille of the Thunder Bay District Health Unit. The following changes will be implemented by the end of the day today. So the following facilities and their programs will close, and they will remain closed until further notice. The Canada Games Complex, which is our largest recreational facility. Other pools like Churchill and Volunteer Pool. Every skating arena, Fort William Gardens, Neebing, Delaney, Port Arthur, Grandview, and Current River. Older adult centers, meaning the 55 Plus Center and the West Arthur Community Center. Other community centers, including those that are run by volunteer boards, they will all close at the end of the day today. West Thunder, Current River, North End, Oliver Road, North McIntyre, Jumbo Gardens, South Neebing, Vale, and Vickers Heights. The Kinsman Youth Center will close. At Prince Arthur's Landing, the Baggage Arts Center and the Water Garden Pavilion will close. These closures are in effect until further advised. There are changes to how council will be meeting. Tonight's committee of the whole meeting will not happen. That meeting has been canceled, and then there'll be further discussion as to how that will play out in the coming days and perhaps weeks and months. Similarly, the advisory committees of council and the working groups associated with those advisory committees are all suspended. And unless there's a requirement for those committees and working groups to meet because of legislation. Some of the operational things that we're doing. First of all, we have enhanced cleaning, enhanced signage, and that signage is for passive screening in most facilities, and personal hygiene protocols are in place in all municipal facilities. The public are asked to contact the city by phone or online whenever possible. We are asking you to restrict visits to city facilities, and there are ways for you to get things done, including paying bills or getting information that is not just coming in and being at our facilities. You can visit our website, thunderbay.ca, for more information. The Harry Kirk Archives and Records Center will be closed to the public, and staff will be available by phone or by appointment. There will be no tours in any city facilities. Transit will continue operating. However, we ask that members of the public reduce the trips that they make in transit and restrict transit trips to only those trips that are necessary or essential. Concurrently, we have enhanced cleaning and disinfection of buses, and that is with a focus on high-touch areas such as buttons and handles. If you are feeling unwell, please do not use public transit, or if you have traveled outside of Canada within the past 14 days, do not use public transit. Customers of Thunder Bay Transit and Lyft Specialized Transit, again, are asked to avoid all non-essential travel. Public Health, Thunder Bay District Public Health Unit is recommending the immediate suspension of all large events and public gatherings over 250 people. Organizers who have questions about those events are encouraged to contact the District Health Unit. One of our events, the Spring Family Skate in support of Pro Kids on March 20th, has been canceled. In consultation with Public Health and as per direction from the province, Pioneer Ridge has taken a number of steps. Visitation has been suspended unless the loved one is very ill or end of life. Large programs have all been canceled, and the homes are focusing on small groups for individual programming at this time. And again, there's enhanced cleaning and distancing protocols in the homes. Child care centers housed in Lakehead Public Schools, and this includes Ogden and Woodcrest Child Care Centers, will be closed during the period of March 14th to April 5th. And this is in accordance with the provincial order directed towards school boards. Two other city-run daycares, Grace Remus and the Algoma Child Care Centers, and city-delivered licensed private home child care will continue to operate today. It is important that families and parents make plans for changes to that. I'll speak more to that in a few moments. During the school closure, our school crossing guard program is suspended. Thunder Bay and District Provincial Offences Courtrooms are closed effective today at 8 a.m. and that is up to the 3rd of April. All matters before those courts will be rescheduled to a later day once courts resume. The public is not to attend to court for any court appearances during this time. And our POA, or Public Offences Act Administration Office, will remain open for counter service. Court fine payments will continue to be accepted at counters or can also be paid by mail, credit card, over the phone, or online. This is, as the mayor indicated, a fluid situation. We are working very fast, responding to very fast changing circumstances. People who rely on municipal services need to be prepared for change and ought to be making alternate arrangements now. I guess questions?
So the first thing, I guess this is probably for Norm, for the bill payments, you said that, people can do it obviously online or at City Hall. If they don't have the capability to get online, what are you recommending?
So we're still here, okay? They can still come to make the payments. However, it's important for them to follow the recommendations of public health. That includes travel restrictions, it includes personal hygiene, it includes social distancing. So precautions are important. And the recommendations and the advice of the public health experts matter.
Is there any thought to perhaps extending deadlines or anything like that as we've seen in other jurisdictions?
You know what, it's a fluid situation and I can't say at this time, but we're also watching government, Ontario and Canada, make decisions as well. We will be responsive and we are sensitive to these circumstances.
Regarding the decision to close city facilities, any idea how many staff this will affect, and will those staff members continue to be paid?
I cannot comment on either one at this time.
Why not?
We're just not ready, that's all.
When do you anticipate that decision coming?
We're working on it.
So at this point, employees at those facilities, there's no word on whether they're showing up to work tomorrow, whether their paychecks are going to continue to come through?
There is no specific answer to that question. The corporation is disparate. Their employees belong to different collective agreements. The employees are non-union, and it depends on the circumstances or the nature of their work. We are working on this now. We are communicating with our employees, but the answer to that question is broad and complex.
You said that there's going to be some committees, I guess, that do have to meet for legislative reasons. Can you tell me a couple of what those are?
I can't offhand, but there may be. If you want some more information, I could probably get that to you.
Getting back to city staff, is there a time that you expect to have an announcement on that, or should staff be going to, I suppose, their managers of their facilities for answers on those?
Yeah, so communications with the staff are ongoing. We're providing information quickly and as fast as we can. Whatever we say publicly remains to be seen, but we are communicating with our staff. And you know what? That might take some time, right? There will be people who are either away or not here now. That information will roll out.
You said you touched more on child care centers. I'm going to hold you to that.
Yes. You mean right now?
Yeah, you said you kind of alluded that you have a bit more to say on that today.
I think I did. But maybe ask me a question.
So you were going to touch more on child care.
You said you'd be prepared for change.
Yeah, I think the answer, thank you, Mayor. The answer to that is, listen, we know that people and parents rely on child care centers. If you're relying on the city child care centers today and tomorrow, you ought to be working on alternate arrangements now. If you haven't already, this is very important. We are making decisions quickly and in the interest of the public.
You mentioned not wanting to make any decisions that have unintended consequences. Is that what factored into the decision to keep transit running? I mean, people obviously have to make medical trips and things of that
Yeah, do you
nature.
want
Yeah, so on the transit piece, we talked specifically about transit today in terms of continued provision for that service. Obviously, it's fundamental for a lot of people who don't have any other option, who need to have access to transit to attend to medical appointments or to get to work or whatever the case may be. So we've decided that we will be maintaining transit. In terms of your comment about unintended consequences, I think is what you said at the beginning. I mean, we are very clearly aware of how reliant a number of people are on city services, and that is what makes the decisions that we're announcing today very difficult. We know there will be consequences for people, but having said that, I think there is a very clear indication for people that are following this, and that's got to be just about everybody by this point, that many organizations, public institutions are making similar decisions. We all want to make sure that we're ahead of this, not behind it. I think that ultimately it is very inevitable that we will be faced with the virus in Thunder Bay. I think that most people would understand that's likely to be the case at some point. And again, for me, I would go back to what are priorities for me. Certainly, one of them being that as a corporation, that we're not seen to have made decisions or not made decisions that potentially could lead to a negative consequence for our hospital, when we know all North American hospitals just simply are not going to have the capacity to deal with a surge. And we're all doing what we can to ensure at least one of the things we're trying to accomplish is to flatten out that curve.
All of these services that you kind of mentioned today are something that probably some aren't necessities for many people. The complex, for example. Are there any necessary or probably more essential services that are under consideration for changes at this point?
Yeah, go ahead.
So what we've done specifically so far is what I've mentioned. We're working on all the services that we provide and working on contingency plans and identifying what is necessary as we scale. Okay, so we can scale up and we can scale back depending on the circumstances. I can't tell you right now what that would be or what that might look like in the coming days. not just because the external environment is so volatile and changing so quickly. So we're moving fast, we're working quickly, but we know we have vital, essential services that must be preserved in some way. We're preparing for that.
Looking at long-term services, seniors services, do you know if there are any concerns about availability of medical sanitary supplies at those facilities?
So for emergency services workers and for healthcare workers, we have contingencies. We have supplies of personal protective equipment and cleaning equipment. We are looking at sustainability for those supplies now, but should we be challenged in that, we will be no different than any other municipality or entity, organization in North America, frankly. We're doing everything we can to protect the workers, to protect the patients, and to protect the public.
I would add to that as well. So from the very beginning of this, the focus has largely been on vulnerable populations, our seniors, and daycare centers have been the focus of a lot of the discussion right from the very beginning. I've mentioned in our press conference last week, meeting with Dr. DeMille at the end of January and with our MECG very shortly after that. And at that point, we discussed capacity to meet demand when it came to PPE and equipment that's necessary to meet with this. At that time, we had what we needed, but as the city manager has said, who knows where that will go in the days and weeks ahead. But we did reach out and establish very early on in this exercise that we had sufficient stock at that point.
Is there any thought that's gone into, say, bill relief when it comes to, say, taxes and utilities?
So I have nothing I can comment on that right now, but we are looking at what processes we can have downstream. There's no answer right now.
Are there any adjusted policies in terms of remaining city staff who are still coming to work, in terms of work from home, sick days, anything like that?
So the answer is yes. We have sick time provisions in the corporation through our insurance policies, through our collective agreements and all of that, and those will be continued to maintain. We know that government is looking at things in that regard, and we are also examining working from home provisions. And we're looking at that right now, along with telling the people who work here that if they're sick or if they have traveled, as per the direction and advice of public health, that they are to stay home.
Are there any upcoming projects that might be delayed because council is not necessarily going to be there to go through all the steps?
Oh, you want that?
Yeah, it's a good question. So, we've discussed that as well. So, we made a decision to cancel tonight's meeting. We will this week, I'll still be coming into the office. We will very closely look at, and we met this morning with the clerk, asking her to come back, advise us what is on the next agendas of the next 2 or 3 council meetings to ensure that there's nothing that needs to be done that's time sensitive that we miss or that slides by. So those conversations have begun. We will have a clearer picture of that, and we've discussed the continuing, good governance of the corporation that's going to be necessary and required. So we're on that, and we'll have better sense of what we need to do and whether or not we will be announcing future cancellations of council meetings. We'll have a better sense of that in the next 2 or 3 days, I would say.
Okay, good.
All right.
Okay, thank you, everybody. Thanks for coming. Thanks.